That much-awaited COVID-19 mass testing in the country. The government now says Kenyans will have to wait another 3 weeks before the exercise can kick off. Dorcas Wangira reports on the hitch that officials attribute to a shortage of testing kits and personnel.
For 47 million Kenyans, mass testing is touted as a crucial exercise in detecting the prevalence and the spread of the coronavirus. The basis for it is that you cannot fight a virus if you don't know where it is. Every case found and treated limits the expansion. But mass testing does not necessarily mean that everyone in Kenya will be tested. It simply means a wider scope of testing of people at risk for COVID-19. Then the government may make consideration for specific demography in an area. Kenya has an automated capacity to test for COVID-19. The Cobus 8800 machines at Kemri, Nairobi, Kemri Alupe Busia, KNH, the National Influenza Center, the Moi Teaching and Referral Hospital, and the Coast General Hospital can deliver 35,000 sample results in one day. But even with scaled-up testing, it will take not less than 3 weeks to start the mass testing. But why can't we mass test just yet? 1. The samples tested depends on the reagents available. By Friday, only 7,000 reagents were received at Kemri. The global demands for the reagents is too high.
Even as a ministry, we are really working hard to be able to ensure that we can be able to procure more testing kits so that we utilize these machines to reach a bigger population.
Because of the way the world has run out of these reagents, can be 1,700 just for extraction.
The government still has to prioritize the populations that will be tested.
And so the next 2-3 weeks will be very important for us as we first start with targeted testing of the quarantine centers, then for our healthcare workers, and then rolling out the mass testing in the different institutions.
Automation may be faster, but it does not replace the need for human input. The government is in the process of recruiting 5,000 health workers. Further training will be necessary before they can be part of the workforce in the COVID-19 response.
Whereas the lab, after it receives reagents, will say we are now ready to test thousands per day. Who will bring those thousands of samples? Who will collect them? Where will they come from? Will they have ice? Will they have ice boxes and so on? This is a question.
The basis of mass testing is suppression, reducing the infectivity. Studies carried out in Wuhan and other epicenters show that when unchecked, the infectivity or RO of COVID-19 is between 2 and 3. This means that one infected person can infect 2 or 3 others. Mass testing, which uses a track and test, will allow health officials to separate the infected from the healthy and break the chains of transmission. Globally, the recording of fewer cases in Africa compared to the UK, US and China has been attributed to the lack of mass testing in the continent. However, Professor Mwao, a molecular medicine expert, argues the reverse could also be a possibility. Because of the intense measures put in place early, such as social distancing, mass testing could find fewer cases than anticipated. Dorcas Wangira, Citizen TV, Nairobi.